Today we're going to be just showing the basic care needs of our rat here. He is in a little travel lab carrier. It's got these little snap-on sides just so that his body weight can't push up. There's a very heavy water bottle in here to keep the lid on as well. First, just going to take the water bottle out. It does have a rubber stopper, but there's a metal part to this top that keeps the rat from being able to get to that rubber stopper. So the only thing that's in this rat's cage is just this metal tip. And then the top is a V-shaped trough, and you can add your little food pellets in here for them to gnaw, as well as just a little bit of fresh fruit. So I will be running that. And then I will be just moving our rat into a little travel carrier so that I can clean its cage out. This rat's very docile, so I can just put my hands underneath its chest and then move it over to our travel carrier. I am wearing gloves, and then I'll just clean out its cage. We have some bedding that's torn up, and then there's just some stool and urine production that I'll clean out. So we just dump everything out. We then take it to one of our tubs and we spray it out and wash it completely, and then I'll bring it back and get it all fixed up. But now that this has been completely washed and cleaned out, I'm then just going to add some shredded paper. There's bedding that you can buy that you can use for more long-term that's a little bit more absorbent, but just for our travel carriers, this is sufficient. It's nice and fluffy, but there's no dust produced. It's non-toxic, and it's just made out of paper, so there's no concern for the health of the rat. And then I will just refill our little water bottle with fresh water. And then I've already added in some new pellets, and these pellets are nice and hardy and hard, so that when the rat is chewing on them, it can kind of sharpen down the incisors a little bit. So I will just take our rat and put him back into his nice clean cage. Look at that. And again, just picking up from underneath the chest because we are pretty docile. I snap this back into place and I push our water bottle tip through. And so what you'll see here is this nice V feeder, and he has a lot of room to run around, just some nice fresh food. And normally, as long as this cage is relatively clean, you can just add more food and add more water without even having to handle the rats for a laboratory situation if you're really just focusing on washing and less interaction. When we're talking about identifying rats, in a laboratory setting, it's going to be a little bit more difficult than if this was just somebody's pet rat. If they were a pet rat, we would just usually be dealing with one or two, and they'd have distinct markings. In this case, and especially in a lab case where most of the rats look similar, the best way of identifying them would be a microchip, but that would also be a pretty expensive way of identifying a rat. There's also ear notches that can be done to identify them, to where there's different types of notching on the ears, and that would correlate to a specific number up to 99. And then occasionally there's also tattoos, as well as just non-toxic colors for a temporary identification. But since this is just a single lab rat that's hanging out with us for the day, we have a cage card with his name and his history on it. And then that is how we would identify this little guy. When we're talking about restraint of rats, I usually let them grip onto a nice wire surface, and then I just restrain the head between my index and middle finger, and then the legs, the front legs, I'm restraining with my thumbs and my ring finger. I then kind of control the back end and the tail, and then this is an easy way of identifying if we're male or female with this restraint method. Obviously we're a male with these large accessory sex organs we have, and then our os penis is visible as well. We have no visible nipples. A female would have obvious nipples from birth. And then a little bit about reproduction with these rats is the gestation period for a female is about 22 days, and the litter size is about 6 on average. And then as far as the female goes for her puberty, it's between about 37 and 67 days, and then the male is closer to 40 to 75 days, and that's just on average for puberty. But that's a little bit about identification and reproduction. We are doing a sub-Q injection on our rat. He is being restrained so that he can't turn and bite, and also can't run away from us. He can grip onto the towel or onto the grate in front of him. We have a 25 gauge needle. I'm going to tent the skin over his back, insert at the base of that tent, and then inject slowly, and then pull out. And that is how we would give a sub-Q injection. We're going to be doing an oral dose of medication with our rat. I have a spec speculum and then an 8 French little flexible catheter to insert in the esophagus. The speculum is so that the rat doesn't bite down and chew on the catheter. And then I have it attached to my syringe. So I just slowly open the mouth. And then I will just insert the medication and allow the rat to swallow. So we have our rat, and I'm going to hold off at the base of the tail and then use some alcohol to wipe down our tail. I'm going to insert my needle with the bevel facing up into the tail vein. I'm just going to pull black tack slowly on my syringe until I get the amount of blood I need, which in this case is just a few drops. And then I'll hold off on the tail as I pull the needle out. We are going to be discussing our mouse today. So in here we have just a small lab mouse. And what I'm going to be doing first is just collecting it and then transferring it over to a small travel carrier just until we get done cleaning his cage. I wouldn't leave him in this because there's a likelihood he would get out of it, but just while we're cleaning the cage out, at this point I'm going to dump all of our old bedding and materials while wearing gloves, and then I'm going to go clean it out in our sink or our tub. And now that we have it all washed out, we're just going to replace the bedding. We had some paper towels in there for him to shred up. That can be an enrichment device. Toilet paper rolls work too. Because this is just a travel carrier, there's not a whole lot of like spinners or really high enrichment toys, but just some extra bedding can work for them to burrow and play in. And then paper towels to shred up can help as well. When it comes to our feeding and watering requirements, mice need to grind down their teeth just like the rats do, so we have some hard pellets of food in our feeder here, and that's for him to kind of chew and gnaw on. And then we also have our watering device. The watering device just sits nicely in this metal container here. So this rubber stopper, which we wouldn't want the animals to gnaw on, is actually protected by this metal stopper. And then there's just some fresh water in here. So this is kind of what our travel carrier looks like, and he could stay in this for long periods of time if necessary. When it comes to identification of mice, what we like to do is, my goodness, stop biting me, stop it. For identification of the mice, usually there are ear notches that are visible, or a tattoo or a microchip of some sort. And then when it comes to handling, we just grip slightly around the thorax and then place into our regular carrier. We're going to be talking about recognizing and restraining mice. So this particular mouse, if I needed to determine which mouse it was, I would be looking for ear notches. However, this is the only lab mouse we have in our hospital right now, so the cage card is enough to identify it. It is a regular white mouse with no significant markings. So from here, what I'm going to do is just grasp the tail near the base. And then once I can grasp that without hurting the mouse, I'll be able to transfer it over to our little grate topper here so that I can let it grasp on and then scrap it right between the shoulder blades by a little pinch of skin. So at this point, it's pretty well immobilized. I do have the tail grasped as well. And then I can also isolate the abdomen area so I can determine the sex of this. And now we'll talk about a little bit of sex and reproduction. So reproduction regarding the mouse, we start out by determining the sex. There are no large accessory sex glands. I can see her vulva as well as her rectal opening, and they're very close together. She also has some distinguishable nipples, so I am comfortable labeling this a female. Mice generally reach puberty at about day 30. And then their gestation period is shorter than the rats, just by a couple of days, between 19 and 20 days. And then they also have a larger litter size of about 10 to 12 pups versus the rats 6 to 12. They are also spontaneous ovulators, just like the rats are, meaning they can breed very quickly over and over again, making them wonderful for reproduction. Intraperitoneal injection of our medication into our mouse. We've isolated this hind leg and we're going right in that line, away from any internal organs. We're inserting at a 30-degree angle into the abdomen. We are then pulling back on our plunger to make sure that we don't have any urine or stool, and then we're injecting our medication. And then we're pulling out, and that's our injection. Have an assistant kind of isolating the back end while I scruff at the shoulder blades. I'm using that scruff to make a tent. I'll then insert my needle at a 30-degree angle, withdraw the plunger to make sure there's no blood, and then inject slowly, and then remove my needle. We are going to do an oral dosing on this rat, or on this mouse. We have our blunt syringe tip with a ball tip. I'm then going to isolate this rat's head and insert the needle. He is trying to bite it. And then slowly forward that into the esophagus and insert my medication.
Is it a he?
It's a she. We have Benny, our rabbit, here today. She's in her little travel carrier, but just some things about the basic travel carrier is it has a graded bottom so that the urine and the stool can go through. You can kind of sit a second tray down here to be cleaned and disinfected. She also has a few of her toys in here just to keep her occupied. We have a few little wooden blocks. The wooden blocks are good for her because she can chew and gnaw on them, but it's not going to hurt her. And then she also has a little bell and some more wooden blocks. Bird toys, cat toys, anything that they can't chew up and destroy would be fine to keep her attention, and she uses enrichment devices. We also would, if this was her permanent cage, we would have an outside hanging water feeder so that she can have fresh water, and then also either a feeder on the inside or a hanging feeder on the outside with the food. Their overall urination and stool production can be collected, like I said, with a tray on the bottom, or they can be litter box trained. The litter box would need to have paper shredded litter instead of clay or wood chips because they're likely to eat them. And then from there, you'll have to clean out the urine production daily just because of the amount of ammonia and the smell that is included with that. It also keeps them clean and fresh if they're not just sitting in their own urine. And then from there, they like to be in cooler environments. Anything over 85 degrees, they can go into heat stress and have issues with that. So a nice cool environment is the best place to keep them. And then definitely have fresh water, especially if they're outside on warmer days. Their food, they are herbivores, so they need usually a commercial diet that's 15% protein and 10% fiber. You can add extra fiber through hay, like Timothy hay would be a good choice to make sure that they're passing all of their stool, they're not getting hairballs, and they're going to the bathroom regularly. They can also be supplemented with fruits and vegetables when appropriate, but not too much. They can have some issues with their stool if they're supplemented too often. And then when we talk about handling our rabbits, we basically just want to control the rear end. So we go to them with a nice, soothing, calm touch and voice so that they feel comfortable. And then you can scruff over the shoulder blades and then hold the back legs taut to your body so that they can't kick and either injure you or their back. And then as far as identification, the best way to identify a rabbit in the clinic here would just be with a cage card and markers talking about what our rabbit here looks like. But you can also use microchips, or in a lab situation, you can have tattoos if all the rabbits are similar in appearance. So we're now going to show restraint and identification of our rabbit. So we obviously have a solid black rabbit here, and then we're going to be talking about how to sex her and confirm that she is a female. But our cage card basically identifies her as a solid black female rabbit. She has some white spots on the front tips of her toes, and then I'm also going to show a little bit of restraint. This is a very docile rabbit. She really enjoys to be pet, so I just kind of soothe her by petting in between her ears and on her back. And to restrain for just a basic procedure, I like to wrap her in a towel. It makes her feel comfortable. I'm able to control her back legs and then also kind of scoop from underneath. And then I just hold her for like a nail trim procedure. Her front feet are out. And then I can also scrub her from here too by kind of wrapping around her head. So she's secure, she's not going to kick out, and we can access her front legs and head and ears if needed. If we were to need to restrain her upside down, some rabbits are very agreeable when you place them on their back. They get very docile and almost in a hypnotic trance. So now she's upside down, wrapped in her towel, and we can pull her back legs out. This also gives me access to her genital area so that I can isolate and see if she is in fact a female. And what I'm looking at now is a slit-like opening, which confirms she is a female. When you isolate it and look a little bit further, there's no penis that she can protrude, and you can see the mucous membranes of her vulva, confirming that she is in fact a female rabbit, and she's also very calm and isolated in this restraining position. From here, you could also do a rear leg nail trim, take a temperature if needed, and just overall take a look at her ventral aspect. And then just slowly roll her back over. Now that we've determined she is in fact a female rabbit, we're going to talk a little bit about her reproduction. Different rabbits reach maturity at different ages. The smaller rabbits usually reach maturity a little bit earlier than larger rabbits. As a female, she is an induced ovulator, which means that after coitus she goes into her ovulation period. It is seasonally dependent for the most part, but she would go into her ovulation about 10 hours after coitus, and she would have her gestation period from about 29 to 35 days, depending on the size of the rabbit and just the length of the gestation period. We're doing our sub-Q injection on our rabbit, so we have an assistant kind of holding her back leg so she doesn't jump, and then I'm taking a little bit of the scruff right between the shoulder blades. I'm going to insert my needle with the bevel up into the tent that I'm creating with my left hand. I'm going to pull back on the syringe to aspirate, making sure there's no blood, and then I will inject and pull the needle out. And that's a sub-Q injection on our rabbit. For our blood draw, I'm just going to use the vein of the ear here. I have an assistant kind of bracing her back in with her elbow against her abdomen area, just kind of bracing her in, and then also scruffing over the neck just so she feels a little bit more comfortable. And then isolating the ear, she's also applying pressure at the base of this ear. I'll douse the area with a little bit of alcohol, and then I will take my small TB syringe and insert with the bevel up into that vein once I see my flash, and then allowing a little bit of blood to flow into the syringe. And once I have enough, I'll just hold off and then pull. With kind of isolating and restraining our birds, you first have to know their temperament. These birds we work with quite a lot, and they are very easy to maintain and hold. They're also very friendly, especially this female here. So getting her out of the cage, I have my towel ready to restrain her for her nail trim, but I also just know that if I go in and I ask her to load up, she'll just kind of sit down on my hand. And then I'll just bring her out of the cage. And I like to place her over on her grate here where she has some stability. And then I simply just drape a towel over her. And I'm able to pick her up and restrain her. So now I have her in her towel. Her feathers are held close to her body, and then I'm also maintaining the head. And she's able to kind of chew on this towel, which is a way of keeping her occupied and away from my fingers. And from here we're able to just kind of look her over. She is a very friendly bird, so if you need to kind of move her around and see different areas, she's very agreeable. But that's kind of how we would get her out of her cage and take a good look at her and restrain her properly. We're going to be doing our nail trim on our female bird here. So what I'm going to do is just take our towel and I'm just going to drape it over her body, and then I'm going to hold her wings close to her body and then control her head at the base of her jaw. She now wants to chew on this towel, which is exactly what I want her to do. It'll keep her beak occupied and it'll keep her from biting me. So as long as she's got something kind of to hang on to and chew on, she'll be restrained. So I'm now going to pass her over to our assistant, who's going to hold the same way. And then I'm just going to simply start trimming her nails one by one. So I kind of cover her head and let her do her own thing, and then I'll take one nail at a time and just trim them. And her nails are white, so I'm able to see all the vascularization inside the nail, so I know how short to go. If they're black, however, I would just use the anatomy of the nail, kind of where it starts to taper. I wouldn't go higher than that taper. But her nails are pretty easy to see. And then when I get all those nails trimmed, she can go back to her cage. So we have our cockatiels here, and one is a female and one's a male. We have them in a little travel carrier that the owner brought in. They have a little bowl of water and food at the bottom, and I can see some of their droppings. So from this, I'm able to collect a little bit of objective data, and then I'm also able to ask the owner more specifics. But overall here, I can see the feed that they're feeding. I then ask the owner if that's what they're eating at home, and if there's any supplementation with fruits or vegetables or anything like that. And then also I see that there's nice clean fresh water. I kind of ask about their eating habits and their drinking habits and about how much they're eating and drinking a day. I can also see the stool. Since we do have two birds in here, it's hard to tell which one it's coming from, but the piles of the stool I see are a normal greenish tint. They're semi-solid in consistency, not too liquidy, and they don't have any undigested food or any signs of parasites in them. From there, I talk about going over just the appearance of our birds before our full physical exam. I do notice that our older female here does have some self-mutilation marks on her. Asking the owner about this, it is a common occurrence for this bird. They have her in a sweater to kind of protect her skin and her feathers, but overall this is something that we've worked on for quite a while, and it's just a temperament thing with this bird in particular. And there's not a lot out there that's been able to help her aside from just keeping her in her sweater. The male is a little bit younger, but he has a full, healthy feather appearance. He doesn't have any gaps or anything like that going on with his appearance, and then he looks very smooth, and his feathers are very symmetrical. So he looks very, very healthy just from appearance. And then from there, we talk about enrichment at home. Even in this cage here, they have this nice swinging branch, which adds some enrichment. At home, we would talk about the toys that are in the cage, as well as sleeping habits, how often they have solid darkness, if they're covered at night, things like that. But that's just a few ways to obtain some objective data before we actually take them out and start doing our physical examination. And then that would give us some even more information on them.